Welcome back to the Jacksonville Buzz. Today we'd like to welcome one of the top dentists in North Florida, Dr. Scott Wagner from Eccella Smiles. Welcome.
Thanks.
How are you?
Glad to have
Very
you.
well. Glad to be here.
We drug you out of the office to get you in here today.
Sometimes you got to sneak out.
Dr. Scott Wagner, tell us what separates your practice from all the others.
Oh, geez. There's a lot of great practices in the Jacksonville area, so I never want to be negative about anybody, and there's a lot of really talented dentists. I think the thing that's always important if anyone's looking to be different is obviously you want to shop around and for example, we have a lot of before and after shots and images on our website. And the challenge is yes, you can say you do this, you can say you're a cosmetic dentist, you can say you treat TMJ, you can say you do Botox, but really, do you do those things and do you have proof in the pudding? Do you have examples of cases that, like your mouth that you've
Right.
done and treated and successfully made a huge difference for someone? Because anyone can hang up a shingle that says, I'm a cosmetic dentist, and that means technically you put in tooth-colored fillings.
Yeah.
Well, I don't know that that's necessarily, the way I would shop for someone to treat my own mouth, but, we try and differentiate ourselves by using the best labs, the best materials, having the best technology. So I jokingly say I have an obscene amount of technology. Well, dentists like to be technology hounds, and
Right.
you don't want to have a weak link. So I'm only as good as my weak link. If that's training of my team, if that's training of myself, if that's equipment or technology that we could do that could allow us to make the patient's experience better, then obviously that's a lot of the different ways that we try and separate
And you have
ourselves.
some pretty advanced training, is that correct? You were discussing earlier
Yeah.
the specific training.
Yeah, the Las Vegas Institute.
So LVI Global is the new, I guess, long-term name because they have gone global. They have a training center now in Australia.
That's right.
They have one in Japan. They have one in Europe. So it's LVI for short. Las Vegas Institute for Advanced Dental Studies is what we've always referred to it as. But LVI is really the preeminent postgraduate dental training center in the world. It is unique in that not only are they training in a live, they're bringing in patients, which is unusual. Most training centers are going to say, all right, here's everything, here's how step-by-step of how you do it, and it's all a slide presentation for doctors.
Okay.
So it's not really a hands-on training center. Well, LVI is, and it's one of the
That's
few
right.
places in the world where you're literally bringing a live patient and they walk you through all these steps. Now, I've been going there since end of 2002, and I continue to go. And because honestly, if you're not staying ahead of the curve, you're really falling behind. There's just things are flying at rapid pace now.
Wow.
Yeah, and that obviously keeps you above and above. You continue to just excel, and when you put that many hours and flying out there, and
Right.
I'm assuming you probably teach out there too. at some
Well,
point.
I taught for a few years,
Yeah,
and I made the election to not teach so I could be. It was a harder thing with my kids being so young, so I just decided to stay home. At some point in time, I'll go back to teaching. But
So when you have that much advanced training,
Right.
when you're in public, say you're in the airport, is it hard? Is it hard to look around
yeah,
the room?
we were joking about that earlier. That it's really hard when I travel or if I go to different places in public and I look around and I look at this person and go, oh, they're severe clinchers and grinders. You see big masseter muscles really swollen out, or if you've got somebody who's really well overweight and their head is leading. We jokingly say their head comes in the
Right.
door first because literally they're striving to breathe.
Wow.
If they're so overweight and they have probably obstructive sleep apnea and they've probably worn down their teeth, they're clenching and grinding, and they're just trying to survive every day. And we have this saying, you need three things to live. You need food, you can go a month or so without food. You need water, you can go almost a week without water.
Right.
But literally you can only go minutes without air. And at night, people are struggling, especially now. I'm 5'8", $155, and I have apnea. You wouldn't think I have apnea, but I have moderate apnea, and I treat
Surprising.
it with an airway appliance. So I live with it and I treat it. So I know what that is. And it used to be thought of as an overweight person's condition. It
Right.
really isn't. And almost anyone. I mean, we were briefly talking
Yeah,
about
we
you.
were.
You have a lot of wear on your anterior
That's right.
teeth, and so automatically, if you came to me as a patient, I'm going to say, all right, we need to figure out why he's got all this wear. Is it snoring sleep apnea? Is it a restricted bite where you pulled back by an orthodontist, which was an older philosophy that they would pull out the premolars and pull everything back? So these are all these big red flags that patients don't have any idea necessarily why. If TMJ patients, pain patients, tend to be female more, and that goes down to biology and physiology, but males can have just as many TMJ issues, but oftentimes there's no pain, but they'll just obliterate the teeth.
Wow. Oh, wow.
So you get these worn down teeth, and most guys say, well, if it doesn't hurt, I ain't gonna treat it.
Sure.
You know, so, okay, that's one philosophy, but it's something I can at least say, I can treat that. Now, when things start cracking and breaking, and they got to get root canal to crown, root canal to crown, root canal to crown, then lose a tooth and lose a tooth and lose a tooth.
Yeah.
Then they start going, okay, what do I need to do to fix it?
Right.
Wow.
And then we come into that situation and like, all right, well, we'll reopen that conversation we had 10 years ago.
Yeah.
And now that you're ready, now that you understand where I'm coming from. Yeah. So, you know, it's opening the book, allowing when somebody's ready to see the things that we talk about. It's not done in a sales pitch. It's not done anything. I can do this, I can do this, I can do this. How do you want me to treat you? And they may stay ultra conservative. And, you know, my classic example is I had a CEO come to see me years ago, and he was a patient for a long time. I said, Mark, we can do this, this, or this. And he goes, oh, we're just going to stay basic. Well, 10 years down the road, he had a baby tooth, and that baby tooth ended up failing. And then he finally said, I'm ready. And I said, ready for what?
Yeah.
So we had to he said, well, years ago you said we could do this smile work on me. Wow. I said, oh, right, okay. So let's circle the wagons. We started over kind of from ground zero, and then ended up doing a nice veneer case on him.
Maintenance and prevention are just as important.
You've been a wealth of knowledge today. How can people at home get a hold of you and find you at Eccella Smiles?
So EccellaSmiles.com, E-C-C-E-L-L-A. It's an Italian word that means excellence or to excel, but EccellaSmiles.com or 904-834-3737.
Thanks so much for coming on. Amy,
yeah,
it was great.
Yeah, I'm super informed.
I've
Many
learned
more
a lot.
questions we'll be asking afterwards.
Sounds great.
Thanks so much for joining us on the Jacksonville Buzz. We'll be right back.